Welcome to the Sarah Finkelstein Show. We're going to be talking about Medicare, a very hot topic today. Why? Because there are 11,000 people turning 65 each and every day across the United States. And what does that mean? At 65, they become eligible for Medicare. Today is February 1st, 2022. Gosh, I can't believe January's over already. Well, here we go, the good, the bad, and the ugly. Where's my PowerPoint? Where are my slides? Missing in action.
Click to add it.
Thank you, sir. Tech support. You gotta have tech support these days, boy, I tell you. So what is Medicare? Well, Medicare is a federal health insurance program for people that are 65 and older. But don't be fooled. It also covers people that are younger than 65 who are on Social Security disability. So if you know anyone that started their Social Security disability benefits, you can share with them that after 2 years, 24 months, they do qualify to go on Medicare. When people go on Medicare at the age of 65, they have two options, two very different options. One of them is a Medicare Advantage plan, and the other option is a Medicare supplement plan. So those are the two separate options. Now, Medicare supplement plan is also known as a Medigap policy because it pays the gap that Medicare doesn't cover. And Medicare supplement plans work hand in hand with original Medicare. What does that mean? That means with original Medicare, you can go to any provider across the nation. That means any doctor, any specialist, any hospital that accepts Medicare, you can go. It's kind of like you're in the driver's seat, right? You can choose any provider of your choice that accepts Medicare. The other option is a Medicare Advantage plan, which is different. It's not, you don't get to go to any provider of your choice. There are networks involved. The Medicare supplement plan is not, I underline and repeat, it is not managed care, but a Medicare Advantage plan is managed care. So it's very different. And you have to understand what managed care means. It means that if your doctor wants you to have a certain treatment or procedure, the plan can come back and say, hey, before we try that, let's try this, because they're trying to keep their costs down. That's how they're able to offer all the extra perks that you'll find inside a Medicare Advantage plan. So make sure that you understand the differences because it's a very important distinction. I always like to say that with a Medicare supplement plan, and again, that works hand in hand with original Medicare, you do pay a monthly premium. So you're paying now, whether or not you need to go to the doctor or the hospital or have any surgeries, you're still going to be paying your premiums. That is referred to as pay now. Whereas with a Medicare Advantage plan, many of them have a zero monthly premium. Now you still have to pay for your Medicare Part B, B as in boy. Everybody has to pay a monthly premium for that, but there's no premium oftentimes for the Medicare Advantage plan. But it depends on where in the country you live. There are some Medicare Advantage plans that do have some small monthly premiums. And because a lot of these plans do not have a monthly premium and you just pay your co-pays or co-insurance, we refer to those as pay later, because if you don't need the services now, if you're not going to your doctor or getting admitted into the hospital or having any treatments, you're not going to be paying anything. So that's why it's called pay later. Whenever you use the services, there is a copay attached. Now, a lot of the Medicare Advantage plans do have a built-in drug plan. So you don't have to pay a separate premium for your drugs because it's embedded in the Medicare Advantage plan. By the way, a Medicare Advantage plan is Part C of Medicare. There are 4 parts to Medicare: A, B, C, and D, and a Medicare Advantage plan is Part C of Medicare. But oftentimes people refer to a Medicare Advantage plan. So if you go with original Medicare and a supplement plan, you do need a standalone drug plan, which does have a monthly premium. Often it does have an annual deductible. So just be aware of that. But the difference is when you have original Medicare and a supplement plan, it gives you the flexibility to choose your drug plan. When you have a Medicare Advantage plan, you don't have the luxury of choosing your drug plan. It's embedded into the plan. And think of a Medicare Advantage plan as your go-to plan for all of your healthcare needs, your doctor visits, your outpatient procedures, your hospitalizations, your prescriptions, all in one plan. If you decide to sign up for a Medicare Advantage plan, you have, again, 2 options. You can sign up for an HMO plan, which does have certain restrictions, such as you have to get a referral to see a specialist. And some people find that process to be cumbersome to request a referral. So that is a restriction. Another very important thing that you have to be aware of with an HMO plan is if you go out of network, it will not cover you whatsoever. So if you're on an HMO plan, it will not cover you if you see a provider that is not inside the network. That bill will be totally on you. Now, your other option with the Medicare Advantage plan is a PPO plan. Gives you more flexibility. You don't need a referral to see a specialist. And oftentimes you can go out of network. However, just keep in mind that it's up to the physician that you see who is out of the network. It's up to him or her whether or not they accept the plan's terms. So it's not an absolute that you can go to any doctor when you're on a PPO plan. It depends on whether or not that doctor will accept the plan's terms if they are an out-of-network provider. If that doctor is in network, then of course there's no issue with that. So in life, there are pros and cons to everything, right? You know that. So a Medicare Advantage plan does have some downsides, as does a Medicare supplement plan. There's no one size fits all. It depends upon your needs and your goals and your health. Really, that's an important factor. But there are some negatives or some things that you need to be aware of, some disadvantages in your Medicare Advantage plan, which we're going to be seeing in the next slide. But the disadvantage with a Medicare supplement plan is that you will be paying a monthly premium whether you go to the doctor or not. So here are some possible disadvantages of a Medicare Advantage plan. And we're not saying that a Medicare Advantage plan is bad. We're not saying that a Medicare supplement plan is bad. They're different. And it's important to understand the differences so that you can make a wise decision based on your needs. So, for example, a Medicare Advantage plan is a calendar year plan. So, what does that mean? That means that each year the plan changes. The providers could change, the benefits could change, the co-pays could change. It's all subject to change. That's why it is referred to as a calendar year plan. Everyone who is on a Medicare Advantage plan will get a document called an annual notice of change. Usually happens around September. And this document indicates all the changes that will be happening to that particular plan. Now, you may have seen commercials on TV that make it seem like everything is free inside a Medicare Advantage plan. But there are copays. So let's say if you never ever go to the doctor or hospital or use anything in your Medicare Advantage plan, then yes, you will have a zero cost. But let's face it, how many people never ever go to the doctor or end up in the hospital or have blood work or use the ambulance? It's very, very rare. Because of the fact that a lot of the Medicare Advantage plans have a zero monthly premium or a very low monthly premium, there are copays. And there is also something called a maximum out-of-pocket amount. MOOP. What does that mean? That means that each time you go to your primary care doctor, there's a copay. You go to the specialist, there's a copay. You use the ambulance, there's a copay. You have blood work, there's a copay. The max amount of pocket figure protects you and it protects your financial exposure because that number tells you what is the most amount of money that the plan potentially could cost you in one calendar year. But again, it all depends on your health. If you're very healthy, it will not cost you very much and you'll never meet that maximum out of pocket. So it's important to be aware of what that number is. And don't forget that there are network restrictions when you are in a Medicare Advantage plan, whereas with the Medicare Supplement plan, you can go to any Medicare provider anywhere in the country. So remember what managed care means and be aware of that. And a lot of times people do not anticipate something happening to them health-wise. In other words, a lot of 65-year-olds are very healthy, fortunately for them, and they expect to be very healthy for the rest of their life. But then something happens, the unexpected happens, and they end up with a financial surprise that they were not anticipating. So be aware that there are costs that you may not expect. Gee, you know, I'm so healthy, nothing's ever going to happen to me. And also remember with a PPO plan, which is a Medicare Advantage plan, if you go to an out-of-network provider, remember, it's up to that provider to say yes or no to accepting the plan's terms. So be aware, be informed, know the pros and cons so that you can make a wise decision. And this is a very important point, which is a trial right period. I don't know if you've heard of this term, but it's very, very important. So let's say that you start out with a Medicare supplement plan and you decide, hey, you know what? I've seen these commercials on TV. They've got free this and free that, and they throw in a free gym membership, and maybe they offer dental benefits and vision and all this wonderful stuff. And you decide that, hey, you know what? I'd like to give it a shot. So if it is the very first time that you are trying a Medicare Advantage plan, you get a trial right period. And what is that? That allows you to try the Advantage plan for up to 12 months. And if you don't like it for whatever reason, you can go back to original Medicare, get a supplement plan without having to answer any health questions. Now, if you wait beyond the first 12 months and you decide you want to go back to original Medicare and get the supplement plan, you will have to answer health questions. So that means that your application for the supplement plan is not guaranteed. It all depends on your health situation. And yes, you could be denied for a Medicare supplement plan based on your health. Now, when you first enroll into Medicare, within the first 6 months of your Medicare Part B, B as in boy, effective date, you can go to a Medicare supplement plan and you do not have any health questions to answer. But if you do it after the first 6 months, then yes, you would have to answer the health questions. So just be aware of the trial right period and what it means for you. And now I'd like to talk about the different enrollment periods that are attached to Medicare. So IEP stands for the initial enrollment period. That's when you turn 65 and you're coming brand new to Medicare. Now, when do you apply for Medicare? If you're already on Social Security and receiving benefits, you'll get your Medicare ID card mailed to you automatically about 3 months before your 65th birthday. So you do not need to apply. However, if you're still working and you're not collecting your Social Security benefits, then you will have to apply for Medicare. And the enrollment period is 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. That's a 7-month window, and that's called your initial enrollment period into Medicare. AEP is the annual enrollment period. This happens every October 15 to December 7. And this is when you can apply for a Medicare supplement plan if you are on a Medicare Advantage plan or vice versa. Also, during the annual enrollment period is when you can shop around for a different drug plan to see if there's one that's more economical, or maybe you've been prescribed a certain drug that's not on your existing Part D drug plan. You could shop around to see if there's another drug plan that includes the new prescription that you've been given. And lastly, the OEP, which is the open enrollment period. That is what we are in right now. The open enrollment period applies to people that are already on a Medicare Advantage plan. It's one last shot to make a change before having to wait until the annual enrollment period, which starts in October. So for example, let's say last year, during the annual enrollment period between October 15 and December 7, you decided to change to a different HMO plan or PPO plan, and now you're trying it out. It's the first quarter of the year. You're not really thrilled with it. You're wondering, did I make the right decision? Well, you've got one more shot to make a change. So this is the period that you could go to another Medicare Advantage plan if you're not happy where you're at. And this period ends, March 31st. So it's from January 1 to March 31. You can make one more change to your Medicare Advantage plan. So thank you for joining the Sarah Finkelstein Show, and we look forward to seeing you tomorrow.